Good afternoon. Since the beginning of the COVID-19 fight, Florida has worked very hard at protecting our seniors, expanding testing, and supporting our hospital workers and hospital system. Particularly with respect to seniors, we focused very critically on nursing homes and long-term care facilities. Early in March, I directed Jared Moskowitz to implement strict screening measures at all long-term care facilities. We had a few dozen cases in Florida, in the entire state at the time, and at a minimum, all these facilities have had to adhere to very strict screening requirements. That includes any persons showing or presenting signs or symptoms of a respiratory infection, including cough, fever, shortness of breath. It was prohibited from entering a facility. Any person who may have been in close contact with anyone infected with COVID-19 was prohibited from entering the facility. Any person who traveled internationally prohibited from entering a facility until 14 days after their return to the United States. Any person who traveled on a cruise ship prohibited from entering a facility until 14 days after their return to the United States. Anybody who has been in a community with confirmed community spread of COVID-19 is prohibited from entering a facility within 14 days of their presence in the community with community spread, and any person who resides in a community with confirmed community spread, as identified by the CDC, is prohibited. So that was from the very beginning, because we understood that COVID-19 presented significant risks to people who were elderly and with people who had underlying conditions. Right after that, I directed Director Moskowitz to prohibit visitation from all facilities. We couldn't be sure who was going in. It was a tough thing to do because a lot of the residents like to have visitors, but we felt it was the right thing to do for safety. We had about 125 cases at the time. We were one of the first states to do it and acted earlier than many of the other states, such as New York and California, in terms of their caseload. And so basically you were in a situation where you had the staff that would have access and workers, and then obviously the residents. Throughout the whole time period, we messaged and advised all seniors, regardless of whether they're in a long-term care facility or not, anyone who was 65 and plus or with underlying health conditions, to stay home as much as possible and to avoid crowds. We also did a formal public health advisory to that effect in March, because ultimately, if you look at the way this affects different groups, there's a disproportionate impact on that community, so we wanted to do all we could do to make them safe. But beyond screening and suspending visitation, our approach to protecting seniors and residents in long-term care facilities falls into three main areas. First, we continue to conduct long-term care facility assessments. So the Florida Department of Health has developed 120 ambulance assessment teams to deploy preemptive measures to prevent the introduction of COVID-19 in the state's long-term care facilities. These teams completed assessments at almost 4,000 long-term care facilities to determine immediate unmet needs and to promote appropriate infection control practices. These assessment teams worked in conjunction with county health departments to address needs and identify facilities where opportunities for improvement existed. The Agency for Healthcare Administration is also in constant contact with facilities throughout the state to make sure we understand and can respond to their needs. ACA staff has made over 1,000 in-person visits and made over 5,000 phone calls to these facilities. Second, the Department of Health immediately sends rapid emergency support teams to facilities who have residents that have tested positive for COVID-19. The Department's Rapid Emergency Support Teams, or RESS teams, operate as the incident command structure for Florida's long-term care facility response. These teams ensure the residents of the long-term care facility are in a safe and secure environment to prevent the further spread of COVID-19. REST teams remain on scene to provide support while staff members are appropriately trained to provide clinical care for COVID-19 patients. This model has been identified by the Center for Disease Control as a best practice for other states to follow. The department's best REST strike team includes an infection preventionist, local county health department staff, regional staff from the Agency for Healthcare Administration, nursing staff, a Florida Infectious Disease Transportation Network team, and an advanced life support ambulance. These REST teams have responded to 93 long-term care facilities with COVID-19 positive patients. The third component is testing. While we have been early and aggressive by implementing screening protocols and prohibiting visitation, testing remains an effective tool to identify an outbreak early and to mitigate any spreading of the virus. I've previously directed the Department of Health to conduct sentinel surveillance in long-term care facilities where residents and staff of the facilities are voluntarily tested for COVID-19 even if they do not have any symptoms. To accomplish this directive, the Department of Health successfully trained 30 paramedics to perform specimen collection and used 12 advanced life support ambulances to randomly collect samples from long-term care facilities throughout the state. But today, we are raising the bar even further. I am directing the Florida National Guard to create more strike teams to significantly ramp up testing in long-term care facilities. They have already visited and tested, I believe, hundreds of residents in South Florida with the National Guard strike teams. We are going to expand that to have 10 teams of 4, and we'll probably expand it beyond there as long as we have enough equipment and PPE, and they will begin their mission in the counties that are being most affected by COVID-19, so primarily in Southeast Florida. They'll be taking samples from all willing individuals in each facility, both staff and residents. It's critical to identify people who test positive as early as possible, and this will help us do that. One of the things that we've learned is you can have someone come in the staff, you can do a temperature check, you can check for symptoms, but people do carry this virus without a fever, without being symptomatic. And so you need to have a strike team going in and aggressively testing to try to preempt that. And what we found in a lot of these long-term facilities is the spread is more significant amongst the staff. But it's not that they weren't following the protocols in some cases, they were. It's just somebody didn't show symptoms. And so doing strike teams, I think, will be good for the residents, but I also think it'll be good to identify this with staff so that the appropriate staff can be isolated and we could prevent an outbreak among staff at nursing home and long-term care facilities. So this is an important additional protection, an additional step, and I want to thank the Florida National Guard for responding very quickly when we asked them to do it. Further thing on testing, we've helped set up and run, the state of Florida, the Florida National Guard, a number of drive-through testing sites throughout the state. One of the ones we did very early on was in conjunction with Memorial Healthcare in Broward County. So far, this has been in operation for between 3 and 4 weeks, I think, and they've conducted over 11,000 tests just in that one place. They actually having people from the National Guard throughout the country come by, look at the site, try to figure out what they're doing right, and it's really become a model for people nationwide. In fact, they had a 4-star general, Joseph Lengel, recently visited the site and said it was one of the most successful sites in the country. And I think that they've gotten their wait time down to, I believe, under 30 minutes. I think I think under 30 minutes. And so they've really running an efficient operation, and that's been a big help to the people of Broward County. So we really appreciate everyone who's doing that. Of course, we have other sites throughout the state, and the National Guard has been tremendous in all their support.